science student, and today I'm going to be demonstrating a newborn assessment. So I'm going to knock on the door and provide privacy when I enter and greet mom, and then tell her that I'm just going to be doing an assessment on her baby today. And then I'm going to verify with mom's wristband and baby's wristband, making sure that I have the correct patient and baby in room. So then I'm going to do my hand hygiene. And because we are doing this demonstration at home, we don't have any gloves here, but I would don gloves. So then, starting with the assessment, I am going to start with vital signs because the baby is quiet right now, so I would have my neonatal stethoscope, and I am going to listen to respirations for a full minute as they can be irregular in newborns. And as well, I'm going to listen to the lung sounds and then do respirations at the end of the lung sounds. So with my neonatal stethoscope, I'll do lung sounds, make sure that they are clear. Okay, and after I've noted that the lung sounds are clear on the front, I'm going to just listen to respirations for a full minute. Okay, and then after listening to respirations for a full minute, I've noted that the newborn's respirations are 35, which is normal. We want them between 30 and 60. So then I'm going to do the heart sounds and then take the apical heart rate, as that is what we want to do with newborns as well. So listen to the heart sounds in all 5 spots. And I want to listen to the apical heart rate for a full minute, as well as there can be murmurs in newborns, and they can be irregular as well. So listen to the heart at the apical site for a full minute. Okay, and then after listening to the heart rate for a full minute, I didn't note any murmurs. It was a little bit irregular, but it was 115, and we want newborn's heart rate around 110 to 160, so that is good. So then I'm going to take the baby's temperature at the axillary point. So I just stick it into the folds and then kind of hold the arm there so that it stays there. And then while I'm waiting for the temperature reading, I'm going to do some cap refills and make sure that they are less than 2 seconds, which they are. And then for newborns, we don't need to do an SpO2 reading or a blood pressure. Those are usually done right after delivery. So then my thermometer has beeped at me and it says 98, which is good. We want them no lower than 97.7 degrees Fahrenheit. And she's sitting at 98. So then, now that I'm done my vital signs, I am going to start more of my head to toe. So I'm going to start with the eyes, and I see that they're clear, they have no drainage, they are symmetrical, and they are in line with the top of the ears, which the ears are symmetrical as well. And then the nose, there's no drainage present, it's symmetrical, and I can see inside the mouth right now. And the tongue moves freely, there's a palate intact, and there is some Epstein pearls, which is normal. And then I'm also going to check the fontanelles, which should still be open because this is a newborn, and the suture lines as well, make sure to see if they're overriding, which can be normal after delivery. But I don't feel any overriding, and the fontanelles feel good. And then the neck is symmetrical, and it looks good. So then I'm gonna move to the chest. So while watching them breathe, I didn't note any nasal retractions nasal flaring or chest retractions. And as well, I can see that the nipples are formed and symmetrical. And then for the abdomen, the umbilical cord, I want to make sure there's no infection, so redness, edema, or drainage, and there's no odor, and the umbilical cord looks intact and good. And then for the gastrointestinal, I'm going to listen to the bowel sounds in all 4 quadrants as well. So I'm going to make sure there's bowel sounds in all 4 quadrants. And I do hear bowel sounds in all 4 quadrants. And this little girl has had her first bowel movement and void, and we want them to have that within 24 hours, which has happened already. So then I'm going to move them just on their side. And I'm going to palpate the fontanelle on the back as well. Make sure it's still open. And then I want to check the spine and make sure that it is in line and that there is no tuft of hair or dimple at the base of the spine, as that can indicate spina bifida. And then I'm just going to listen to the lungs on the back now that I have them on their side. So I'm going to listen to the lung sounds again, make sure they're clear. Okay, and then after listening to lung sounds, I can hear that they are clear. And I'm just going to examine the bottom, make sure there's no Mongolian spots that weren't documented yet. So the bottom, there's good skin integrity, there's no Mongolian spots present. It looks good, so I'm gonna flip her back over. And I'm going to look at the front. Since this is a female, the genitalia looks anatomically correct. And I can see that she has a dirty diaper, so I'm going to change that for Mom while I'm here. So I've changed the diaper, I've changed my gloves, I've done hand hygiene. And then, so I know there's no Mongolian spots, and I also don't see any milia present on the face yet either. And then the newborn's range of motion is very good. They're moving freely. Their skin is intact, their skin turgor. I would check, and it is good, so they have good hydration. And then after I'm finished my assessment, I would swaddle the newborn and hand back to Mom, and then do hand hygiene and go back and document my findings.